Is that gnawing pain that maybe you've been feeling for some period of time something to be concerned about? It could be your back, your knee, your shoulder. So in this video, what I want to do is go over some of the key factors to consider when is it time to come in and get checked out by the orthopedic doctor. Many people have common aches and pains every day. That's pretty typical. I have one very comedic older patient who once said to me, well, if there's a day that he wakes up and doesn't have pain, that's pretty concerning because it probably means that he's no longer alive and sitting in heaven. Hey there, welcome back to my channel. If you're new here, my name is Edmond. I'm an orthopedic surgeon here in New York City. On this channel, what we do is we discuss exercise and orthopedic injuries, and we explore different strategies and tools that we can implement to help us live more physically active lives that will lead to better health and longer life. If you get value out of this video and my channel, please subscribe and smash that like button below. Okay, so when is it time to come in to see the doctor? So I think there's basically 5 key things to keep in mind. So, number 1, if there's a major trauma or significant injury, then someone should come in pretty quickly. For example, I had a patient recently who had come in saying they had shoulder pain, and while we were talking to them, we found out that they had actually fallen 3 months before, and since that time they couldn't lift their arm. We found out that they had a rotator cuff tear, and that patient ended up needing surgery. But in a more ideal situation, if someone has such a significant injury where they fall and they can't lift their arm, that would be something we would want them to come in pretty quickly. Okay, so number 2 is a situation where they may not have been a trauma, but someone has persistent pain that's just going on for some extended period of time. So that's very common. Like we said earlier, many people can have aches and pains which are daily, but very often these things will get better with rest, maybe ice, maybe an anti-inflammatory medication. However, if let's say those things don't work and someone just has persistent pain that's going on and on and on, that is not something that we want to let go. And I would say that if it goes on beyond 6 to 8 weeks, despite trying those other home remedies, that would be a good time to come in. So for example, I have had patients who have waited a very long time, again, maybe with shoulder pain, haven't come in, and that persistent pain can sometimes lead to other problems like a frozen shoulder, which could then extend their treatment and how long it takes to get better. Number 3, not all orthopedic problems have to be pain or an injury. Sometimes they can be weakness, numbness, or tingling. And so those kind of problems often indicate a neurologic issue, which could be emanating from the spine. So in that scenario, I would encourage patients to come in sooner in order to get checked out. Okay, so we're up to number 4. So that would be if someone has swelling in a joint without an injury. And this can sometimes happen. Now, if there is swelling in a joint, which means that there's something going on in the joint, and there was no mechanical problem like an injury, then that would start making us think about a rheumatologic problem like rheumatoid or Lyme disease or something along that nature. So in that scenario, we would also recommend that the patient come in and get checked out right away. They may end up being referred to a rheumatologist ultimately if there's no mechanical underlying reason for that swelling. Number 5, and the last one, which is probably the most concerning, yes, is if there is some sort of lump, bump, or mass, something that's growing that shouldn't be there, that someone has noticed. That would be obviously concerning for some sort of a tumor or cancer, and that would be something that you would absolutely need to come in and get checked out right away. Okay, so that is the 5 things that I recommend that patient come in and be seen for. Again, number 1, if there is a significant trauma or injury. Number 2, if someone has persistent pain that is not responding to regular home remedies. Number 3, if there's some sort of neurologic thing such as weakness, numbness, or tingling. Number 4, if someone has a swollen joint and not associated with trauma. And then, of course, number 5, if there is some sort of bump, mass, or lump. As an orthopedic doctor, I work very closely with physical therapists. It's an integral part to getting our patients healthy and rehabilitated and back to being physically active. And as part of that relationship, we are kicking around some ideas to maybe create some home rehab programs for the classic aches and pains that people typically have, like maybe shoulder bursitis or runner's knee. If that's something that would be interesting, if you could send me a message below in the comments so it can help guide us into what sort of programs would be interesting for you guys. And also, if there are other topics you'd like me to cover, please let me know in the comments below. Thanks for watching, and I will see you in my next video, or maybe in my office. Have a great day.